I've experienced workplace violence, whether it's verbal or physical aggression, in every setting that I've ever worked in.
Sean Pridgeon spent more than 18 years as a nurse. For him, the issue of violence in healthcare is not just data on a page, it's personal. He says coping with that trauma often meant trying to bury it.
And invest my own money and resources into them, right? To be able to make sure that I was able to disconnect and then re-engage in my work the next day.
Pridgeon is active in the Missouri Nurses Association and is a professor at MU Sinclair School of Nursing.
I've been techs prior to being a nursing student in hospital settings, acute care hospital settings, and they have been exposed to workplace violence.
Nurses like Sean Pridgeon, abuse is not rare. Many say it's a part of the profession. Now, hospitals here in Columbia are working to change that reality by establishing supports teams, training, and implementing new systems.
Boone Health and University Hospital were among 65 Missouri hospitals that took part in a Missouri Nurses Association survey regarding workplace violence. In that survey, nurses identified possible interventions to hopefully help reduce violence. Among the top were behavioral emergency response teams at all locations, system-wide screening tool and notification system, weapons detection at entrances with highest risk of violence. At Boone Health, leaders say they have already implemented a behavioral response team to provide rapid help with clinical staff trained in de-escalation. But it's not always a swift response.
And we engage the CARES force and we get to those folks within 30 minutes of the event occurring.
University Hospital, administrators say they are also expanding protections.
We have a program called For You, where we specially train certain team members throughout the organization to respond to our other team members that experience emotional and traumatic situations.
She says prevention is also a focus.
Work with a nationally accredited vendor on de-escalation training.
And for nurses who want to take further action,
is where staff members can file assault charges if they would like, and we have a process outlined for them where there are no repercussions. We provide support.
The Missouri Nurses Association survey also found participating hospitals reported on average of 21 violent incidents per day. For Sean Pridgeon, those numbers reflect a problem he says nurses have carried for far too long.
We believe that patients are not responsible for their actions, which really isn't true. We need to change that misconception. And we assume that violence is part of the job. And that can't be the case if we're going to make this a sustainable profession.
In Columbia, Simone McCandless, KOMU 8 News.